People and Culture here at right in Apple Valley or for Choice Medical Group. We're happy to have every single one of you here today and those that are in our studio audience as well. Thank you for coming. We wanted to share with you a little bit about Choice Medical Group, and then after that we're going to have a few of our doctors come up and introduce themselves to you. And then Jason is going to come and talk to you about Medicare and how that works and give you some options that you've been looking for. Choice Medical Group is the longest standing medical group here in the high desert. We also are the largest, so we have a very large network of physicians, and we're growing every year. We're innovative. We have owners that are looking ahead to the future. We were the very first ones that came up with telemedicine when COVID hit. And we are bringing in new doctors every year, and you'll get a chance to meet two of those doctors today. We have award-winning physicians, as some of you saw when you walked in. On the back of the room, we have Best of the Desert for a medical group. We've been Best of the Desert for many, many years now, including 2020. So we also have a couple of other things, including Senior Kicks. Senior Kicks is a program that we have in place for those that are interested. You don't even have to be part of Choice Medical Group, but we love it if you are. It's monthly. We do different things. We put out a newsletter that has really great articles in it that are written by our physicians. And then we also invite you to come and do painting classes with us. We do jewelry making. We do dances. We do all kinds of different events, Tai Chi and yoga. Right now, a lot of it is being done online. And we love it when people are able to join us for those online events, but hopefully soon COVID will go away and we'll be able to rejoin and have everybody start doing some of the really fun things. We are trying to come up with some COVID-friendly events, like doing walks where we're not going to be close to one another and we're outside. So we are coming up with some of those fun things to do. So at this point, I'd like to turn the microphone over to one of our new doctors. His name is Dr. Greer. He'll tell you a little bit about himself.
Hello, welcome everyone. I'd like to thank you all for taking the time out of your days to come and visit us here, for those that are here and for logging in, for those that may be at home. My name is, as Kathy had mentioned, is Dr. Kenny Greer. If you have trouble remembering that, a lot of times patients come by and say, hey, you're Kenny G, right? So sometimes that works. So that's completely fine if that's how you want to remember. I just want to tell you a little bit about myself. I graduated in 2010 from Loma Linda University School of Medicine, so just down the hill. Some of you might have driven by or heard of it. And then after that, I actually did a stint in the Army. So I worked out in Tripler Army Medical Center in Hawaii, and then I actually did a stint out at Fort Irwin, right in the high desert here. And after my time in the military was over, in the Army, I moved out, and me and my family are now here in Apple Valley, and so we're looking to put down roots, and we're excited to be a part of the community here. And working through these institutions in the military and these larger medical centers, one of the things I've noticed is a lot of times I'll talk to patients and folks, and I'll ask them about their primary care, ask them, who's your doctor, or tell me a little bit about your background. And I'll get answers along the lines of, they'll say, well, I don't really see my primary care doctor, or maybe I know who they are, but I see the PA or I see somebody else, it seems like every time I come in and visit. And that's been a common trend that I've noticed in a lot of the larger institutions. And so I'm excited to come to Choice, and part of what I'm hoping for and shooting for is kind of a more smaller, intimate setting. So my office is actually going to be opening up in November, coming up here this next month. And what I'm hoping for is to get more of an intimate practice, to get to know the patients a little bit more better on a one-to-one basis, and so that you know who your doctor is, you've come by the office, you can say you've seen them, and so that's really kind of what I'm looking for. And so as we move forward into this, into this uncertain time with COVID and everything, and just in general, as you're choosing your health plan and choosing who you're going to be seeing as your primary doctor, what you want to look for is somebody like, if you've had that experience, maybe you have a barber or a mechanic or somebody that you work with who who that person's reliable, that person's your go-to person. That's really what we're shooting for each and every one of you to have in healthcare too, to have that primary care as your foundation. And so that's really what we're excited about bringing you, and that's part of why I'm excited to be working with Choice. And so I just wanted to be able to come out and say hi to everyone. Very excited to be working with Choice, and just wanted to make sure that I put myself out there so you have a name to go with the face. So thank you all for coming out once again. And I have the pleasure of being able to introduce to you one of our other primary care doctors, Dr. Judge, who works in internal medicine. And we're very excited to have her here as well. So I'm going to give her an opportunity to come up and speak a little bit as well.
Hi there. Nice to meet everybody today, and nice to see you guys come out. I'm really excited to be here and meet everybody. My name is Dr. Ruby Judge. It's spelled a little differently, J-H-A-J, but pronounced just like a courtroom judge. That's what I tell everybody. So a little bit about myself. I was born in... Ooh, doggy. I was born and raised in Southern California. I completed medical school in 2013, and then I did my training at Michigan State University, and I graduated in 2016. For the past 3 years, prior to coming and joining Choice here in June, I was working in the hospital setting, so I was actually involved in quite a bit of acute care and taking care of very sick patients, but I also do specialize in primary care. So I can handle both very sick and preventative medicine, and I'm looking forward to hopefully having you see us in the clinic. And in regards to my family, we're also here in Apple Valley, so you may meet a few of our other members. They're also affiliated with Choice. We have my husband, Dr. Mitesh Patel. He's a general surgeon here as well. And also the other Dr. Judge is my brother, who is an ophthalmologist, and Dr. Lisa Gale, who is a dermatologist. We have a lot of different specialties under Choice Medical Group, and we keep really close contact with our doctors. So if you need to see any specialist or anything, we know what's going on, we know who to refer you to, and you'll be in good hands no matter what. So looking forward to meeting all of you, and if you have any questions, always feel free to reach out to our office. We're here for you guys, and welcome to the Choice family. And I'd like to give it back to Kathleen.
Thank you, Dr. Judge and Dr. Kenny G. I like that. I think we all know that singer, right? For those of you that are joining us virtually, in your screen in the bottom right-hand corner there, if you look at it, there's a little bubble. And if you're interested at the end of this to talk to one of the brokers that are going to be talking here today, go ahead and click onto that bubble and ask for to be able to talk to one of the brokers. Give us your name and your phone number, and we'll forward that information over to Jason or one of the other brokers here with us today, so that we can make sure that they get in contact with you. So at this point, I'd like to turn it over to Jason so that he can go through and talk to you about Medicare and all the other plans that are available.
All right. Let me grab this one back.
Oh, you have
Yeah, I do. Thank you. Thank you, guys. Thank you for your patience. Before I get too deep, I just want to make sure everyone has. You saw me walking around, trying to make sure everyone had that. I'm the one that disrupted the cute dogs. I'm sorry. I'll just try to make sure everyone has, because this is going to be important. What this is, folks, is a grid, a benefits grid. And so I know that each year, one of the most important reasons we come out to the meeting is to find out what the Medicare plans are going to offer you starting January 1st next year. And what are their new benefits going to look like, and all this good stuff. And I'm here to give that to you today. And I want to do it quickly. I don't want to keep you here too long. But before I do, I just want to piggyback and clarify something that Jackie was talking about, or Kathleen, I'm sorry. You all have this in your literature, the Choice Medical Group, and if you turn to the back page, you see those insurance company logos? Those insurance company logos there? I just want you to understand, those are the insurance companies that are available to you if you're doctors or if you're a member of Choice Medical Group. Because I just want to clarify that. To some of you, that's a no-brainer, but sometimes someone will ask a question and they'll say, well, is Choice good insurance? And then I have to explain to them, Choice is a medical group. And they're the largest in the high desert. They have more facilities spanning from Barstow to Oak Hills. They are the largest. And so we're very proud to be partnering with Choice Medical Group, and we're glad you could be here with us. I don't want to keep you all day, talking about this stuff, so I want to get right into it. What I like to do first is introduce myself. My name is Jason Trombley. I've been doing the Medicare meetings here for Choice Medical Group, going on 7 years now. And so some of you know me if you come to the meetings, but for those of you that don't, you're familiar with me. My hair's longer this year because COVID-19, I can't get to my barber. And but I hope that'll change soon. Not like Doctor here, he's looking high and tight. Look at, I bet you his wife cuts hair or something. But what I do is I contract with all of the insurance plans. I own my own company. I live here in Hesperia. My parents moved me here for better or for worse in 1988. And I graduated from Hesperia Christian. And when I got into healthcare, I didn't know what I was taking on. But I've been doing this for about 13 years now in the Medicare section of the industry. And it's been very good to me. There's a lot to know. It's a highly regulated industry, and there's always new laws and changes. That's why I stay right in that lane. I don't go out and do all kinds of other insurance. I stay right in the Medicare lane because it really does dominate my focus. And what I want to do is be the best agent that I can for you, the members who need help. My parents still live in Apple Valley. I treat all my clients as if I'm working for mom and dad. The insurance companies pay us, brokers, as little as it is. They pay us. And I want you to understand that. You don't pay us. Choice Medical Group doesn't pay us. Nothing other than just the insurance companies themselves. Whichever one you pick, if we become your agent or help you into a plan, that's how we get compensated. And another side note, me and my wife 7 months ago had a little baby girl. And she's very happy that her dad is a Medicare agent. We don't plan on moving anywhere. Like Dr. Kenny G said, we put roots here. My wife's here, my daughter's here, my mom and dad are here. I'm not going anywhere. And I just want you guys to know that you have a valued resource here, someone you can call. Every one of you I gave my card to. Now, whether I'm your agent or not, I'm here for you as a resource and an advocate. You get weird mail, you don't understand what it's saying, you're getting something from Social Security or Medicare, you need help, who can you call? Hey, Jason in Hesperia, we can call him and he'll go through it with us and explain it. And it won't cost us nothing, and he'll be happy to do it. So just tuck that away. Other than that, what I like to do is before I get into the benefits, and again, we're going to put these benefits on this sheet, but before I get into those, I like to just give a real quick and easy Medicare 101. Because what is Medicare? And so I used to have a color copy of this. I don't anymore, but most of you have that card in your purse or wallet or in a safe place at home, right? The Medicare, and yours is colored red, white, and blue. But that's the Medicare card. And I want to explain to you just real quick how this happens. If you got this, that's because you either had a disability when you were younger for 2 consecutive years and they gave you Medicare, or you just like the rest of us worked and paid into it your whole life and then you get it at 65 years old. And that's how most of us get it unless you had a disability. I believe it or not, I have some clients who are little kids. They have Medicare because they're disabled. But for the most part, they're senior citizens. We get it at 65. I want you to understand there's 3 acts of legislation. It's like a 3-legged stool that lifts up and composes Medicare. And the first one is original Medicare. And that's the card you carry in your purse, your wallet, or in a safe at home. This came under President Johnson in 1965. And this is called original Medicare. And it covers 2 basic components, Part A and Part B. Part A is your hospitalization, right? You paid out of your check all your life, or your spouse did, so now you get that. Part B is called medical. Well, what does medical mean? That means when you go see the doctor. Anytime you see the doctor and any care they prescribe to you, this is usually going to fall under Part B. Okay, so A and B came under President Johnson in 1965. It's a wonderful thing. And what this is, folks, is a contract between the federal government and you that they're going to pay for 80% of your health care the rest of your life because you worked and you paid in and you deserve it. Okay, so that's a wonderful blessing, right? But the curse, and why we're here today, is the 20%. The 20% we're not covered can bankrupt us, right? One surgery can be $1 million. So if you just had the red, white, and blue card, Medicare will pay $800,000 of it. And then if you're like me, you'd get a bill for $200,000 in the mailbox. And then I'd go file bankruptcy because I don't have that in my savings account right now. But thank God what they did is they come out with 1, 2, and 3 other acts of legislation to help us citizens with that 20% vulnerability we have. So there's only 2 other ones, and I'm not going to labor the middle one or go too into detail, but in the early 70s, they came out with what's called Medicare supplements. And that's where you spend lots of money to any insurance company. They're all happy to take it. And they'll fill that 20%. And a lot of those plans, those supplements, a lot of seniors like them if they travel a lot because you don't have to be in a referral situation. The only problem is they don't include prescription drugs. They don't include things you need, vision, hearing, all that stuff. Stuff that's really important to you. But the main thing is prescription drugs because they passed a law, didn't they, that if you don't carry prescription drug coverage while you're on Medicare, you can get penalized. That bill was passed back in 2006. It's very unfortunate, but it is the Medicare Part D penalty, late enrollment penalty. If you go 63 days or more on Medicare without medicine coverage, prescription drug coverage, and you might say, oh, I'm fine, I'm healthy, I don't need it, I'm fine. I don't even take aspirin like my dad, right? Well then, when the doctor says you do need some lisinopril or some metformin, guess what? You go take out a drug plan, and CMS, through Social Security, is going to institute a penalty on you. And so that's why if you have any loved ones that are just coming into Medicare, have them talk to a professional, or if you can remember, you tell them, make sure you carry drug coverage, even if you're not taking medicine. Because the idea is they want everybody on the plan so that offsets the people that are. Okay? So that's just a little something. Now there's one other thing that came out, which is what we're here to talk about today. They came out in the late 80s. They're called Medicare Advantage plans. And thank God they did, because this is what we're going to talk about. Now, Medicare Advantage plans are PPOs and HMOs. And I want you to understand that, because your doctors don't. These doctors do. I'm not talking about them. But the average doctor out there, I get it all the time. They tell the patient, just get a PPO. And they don't realize, because the doctor's not an insurance agent, they don't realize what they're trying to tell you is get a supplement. It'll be easy for me to bill, and I won't have to refer you, and I can. And what they're, and so it's not a PPO. Medicare Advantage that came out in the late 80s are HMOs and PPOs. Now here's the thing, folks. Get your mind off the PPO. Don't even think about it, and don't worry about it. Why? There isn't even one available to us here in San Bernardino County. There hasn't been since 2011. Anthem Blue Cross had a PPO, and it got sanctioned and went away. Now, there are some other products that I'd like to talk to you about that the law prohibits me from talking about right now that won't come into play until next year. So right now, a lot of you have gotten your changes in the mail, and you're seeing improvements, right? Probably it might be wise to stay with the plan you're on, or if you got a specific need that's a stone in your shoe, I'll be happy to look at it for you. Renee will be happy to look at it. And we'll see if we can't better your situation, but only in the sense that we would for our mom and dad. I treat each client like I'm sitting with my mom. If it isn't good for mom, it isn't good for me. We're not here to try and get a commission. We're here to help mom and you guys get the best plan. And what that normally comes down to, folks, is I got to say, Mom, go in the cupboard and get your medicines out. Let's get your medicines out. Let's price them, run them through the garden with each company, right? And we're going to find the best deal for you. Other questions would be, do you have any special needs? Are you diabetic? Are you asthmatic? Is there anything you're fighting? Some COPD? Because there are special needs plans out there that address those things. So again, you want a resource center, a knowledge center, a resource, a Medicare agent who's free to you that you can appeal to answer those questions. Moving right along, there's another ugly thing that I know you all know about, and it's called the Medicare Part B premium. And that's when they take $145 out of your Social Security check each month, don't they? Now, maybe not for all of you. If some of you are under the income guidelines, you can get some relief and assistance, and the Medicare Savings Program will waive that for you. But if you're like the rest of us, $145 comes out of that Social Security check each month. What does that pay for? Well, folks, that is called the Medicare Part B premium. Now, what's Part B? Remember, Part B is the medical. See, they can negotiate the rate with the hospitals. That could be a fixed cost. But the Part B, that's an unknown variable. One person might be sick, the other person be healthy. So they charge $145 for it. Okay, that comes out of everyone's check each month. And that gets us to the late 80s when they came out with these PPOs. I told you not to worry about PPOs. They came out with the HMOs, Medicare Advantage plans. They are still 80-20, but what they do is they're called Part C plans. In Part C, it explains all this to you in your Medicare and You book they send every year, but it's very confusing. So I'm trying to put the cookies on the lower shelf. Part C stands for combine. Part C combines your Medicare Part A and your Part B and Part C, which is extra stuff you need, vision, dental, hearing. I'll get to that, gym membership. And then D, prescription drugs. It puts it all on one card, and you have no monthly bill. So when I explain this to my mom, she says, wait a minute, that doesn't make sense. So I have to spend thousands a year on a supplement, or I can get a Medicare Advantage plan, an HMO that my doctors take, and I don't pay anything? And I say, yes, but Mom, are they taking the $145 out of your Social Security? Yes. That's what pays for it, Mom. Now let me explain to you how your dollar works. They take $145 from you every month, right? And they're taking it from everyone. And at the end of the year, the government has a big pile of Medicare Part B money. It's a lot of money. And by law, they can't go build an airplane or a bomb with it. They have to put it back into health care. So when they go to the legislative table with your money, remember they got your money, who's on the other side of that table that's saying, gimme, 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 gimme? That's right, all the insurance companies. They all want that money so they can get all of you on their plan and put their competitors out of business. Well, the government can't be in business with any one of them, so the government has to be plan agnostic, right, and fair. So the government says, no, we're not going to give you any of their senior citizens' money. What we're going to do is we're going to grade you on a star rating system. Just like little Johnny and Sally get rated in kindergarten on their behavior. If you were good, you got a 5-star. If you got 3 stars or 2 stars, you're probably going to be in a little trouble, have some explaining to do. So the government rates these insurance companies for your benefit. It gives them a star rating. And what's the star rating composed of? Well, they collect data from them. What's your grievances, your appeals? What's your cancer survival rate? What was the procedures for your diabetics? What did you prescribe? What was the outcome? They get graded on a whole host of these things, and it determines a star rating. Now, folks, understand this. Their star rating determines how much money, your money, they get to provide care back to you. So it's important for you to know what your insurance company's star rating is. And I'm going to give it to you here today. I just want to lay these foundations so you know what I'm telling you, what you're learning, what you're going to write down. When you leave here, you're going to know more than all of your know-it-all friends. I'm going to give you the answers to the test. Okay, so let's get into this a little bit. Where are we right now in the year? 2020 has been crazy, hasn't it? We are in the annual enrollment period, which starts every year today, October 15th, and it'll last till December 7th. And that's where you can add, drop, or switch your Medicare plan. This is your recess out of the classroom to get different coverage. Okay, when we get to January 1st, if you feel you made a mistake, if some telesales person got you to enroll in a plan and you regret it, you can get out of it. From January 1st to March 31st is the disenrollment period, where you can disenroll and go back to Medicare. I made a mistake. The rest of the year is considered the special election period, which means if you're retiring, turning 65, if you have any other special needs, if you have Medi-Cal or something, call me and we can work out a special election period for you. But for the most part, we all have this little window of opportunity, October 15th to December 7th, to make these plans. So What I want to talk about now, I'm not going to talk you to death now. We're going to get right into the benefits, folks. And now, when you look at these insurance companies, someone asked a question earlier. They says, why is there a little orange check by some doctors' faces? That confused me too. You know, the answer to that is don't worry about that. It doesn't pertain to you. That has to do with Medi-Cal and Horizon. It has to do with Horizon. It's the sister company. What we're going to talk about today is Medicare specific. So the orange checkbox doesn't even come into play. And you see it says our health plan partners, where they show the insurance logos there. I got to be honest with you, folks. You got 9 of them there, right? 1, 2, 3, 4, 5, 6, 7, 8, 9. And then the 2 bottom ones, IEHP and Molina, those are basically local Medicaid facilitated plans. So we're not even going to get into them. What we're going to talk about is these top 9 ones. Now here's the thing, and I hope this doesn't disappoint you, but I'm going to remedy it if it does. We don't have the room for hours on end. I got to get you out of here quickly, so I'm not going to go over the benefits and the star ratings of all 9 companies. I'm going to pick about 4 or 5 of them, and then if I don't talk about a company that they're all good. They're all basically the same, and I'm going to get into that. You don't want me to get in. If I don't talk about a plan you want to hear about, please call me, and I'll give you every detail. Or you can come back to another meeting later in the enrollment, and I'll alternate plans that I present. Okay, just to be fair. But for the sake of time and interest, I don't want to keep you at a Medicare headlock for too long. So let's get to it. What do they say? Get to the chorus, don't bore us. Okay, let me see here. So let's get into these benefits. Every one of you should have a working pen. And I should have the actual sheet that tells me. See, mine looks different than yours, right? Mine's got writing, yours don't. I just want you guys to know, every year at October 1st, us brokers are salivating and waiting for this to come out. We're waiting for the insurance companies, and they're very tight-lipped with this. But this is what next year's plans are, starting January 1st. This is not this year's plans. So CMS, the governing body, the watchful eye in the sky, says, Jason cannot hand this to you. Otherwise, I'd burn copies and we just hand it to you as you walked in the door. But that is considered an illegal marketing material because it's not pertaining to now. It's for next year. It's in the future. But the law says I can speak it into the air and you can write it down. So that's how we're going to do this. That's how you're going to get the info here. So let's get started. You got your grid here. You see where it says overview notes at the top? That's where we're going to put the company's name and their star rating. So, for Aetna, A-E-T-N-A, that'll be the first one. Let's put Aetna in there. And then I'll come back with the star ratings. Next block over, put SCAN. SCAN stands for Senior Care Action Network. SCAN. The third cell block over, you write it however you want, but I try and abbreviate everything. I just put United Health or UHC. UHC, United Healthcare. I'm sure the fourth company would rather us spell it out than use their initials. Blue Shield. But you write it however you want. And the fifth column over, normally I don't get to 5, but we're doing good on time, so this is good for us. It's Intervalley. And you write it however you want. I put IVHP, Intervalley Health Plan. And again, I see some disappointment out there. If there's a plan that I'm not covering that you want to hear, give me a call and I got every detail on them. And you can fill them in next to your grid if you want. Okay, star ratings. For Intervalley, put 3.5. And I suspect they'll get right back to the 4-star rating next year. But 3.5 for Intervalley. Coming back towards, moving left. For Blue Shield, put 4 stars. This is for their health plan. For United Healthcare, 4 stars. SCAN, put 4.5 stars, 4.5. And for Aetna, put a question mark. They haven't released it yet. I suspect by next Tuesday's meeting they'll have it, but On Medicare.gov, the governing website, they're saying that this plan is still waiting for a determination on star rating. It's got to come any day now. If you can't make it to another meeting and you really want to know Aetna's star rating, call me. I'll give it to you, I promise. Okay, now let's see. Now, we already know we have no deductible. You don't have to write this down, but there's no deductible. Your monthly withdrawal of $145 pays for these plans. So for premium, which is monthly bill, put 0 for all 5 companies. There's no monthly bill. The $145 already pays for it. Okay, how about the out-of-pocket max? What is the out-of-pocket max? An out-of-pocket max is nothing you have to pay. It's not a deductible. It's not something you have to pay, then the insurance will work. No. An out-of-pocket max just says this is your stop-loss limit. If you're ever, heaven forbid, in a catastrophic year, and surgeons are fighting to save your life, and the surgeries are going into the millions of dollars, this is the most you would ever pay in that situation in a catastrophic year. For Aetna, put $999, $999. For Scan, also $999. For United, they're going to gouge you for a whole dollar, put $1,000. For Blue Shield, put $999. And for Inter Valley, put $1,000. And folks, let me just say before I move on, you're going to notice as we go through this grid, it's a lot like Santa Anita's racetrack. They're going to line up within a nose length of each other. But some of them, they're all different. They have different personalities. Some of them puts that money they get based on what? Their star ratings, which is money the government got from who? You. So some of them will put that money in other benefits because they want to be, so some of them are more friendlier towards asthmatics or diabetics or insulin co-payments. And if you want to know who they are, get with me. I'd be happy to tell you. How about hospitalization? 0. Put 0 for all 5. And folks, when I say 0, I mean unlimited stays. So you can be in the hospital, you can be checked back in multiple times. There's no limit to the days in the hospital. It will always be 0 on these 5 health plans starting January 1. Okay? Skilled nursing facility. I don't know if you guys are familiar with that. This is when you're too well to be in the hospital anymore, but you're not quite well enough to go home. So they put you out in an acute therapy place. We have one over here by Target. There's one over on Desert Knolls. All you need to write down for this, folks, and you can write this in each cell block of all 5 carriers, put 1-20 equals 0. 1-20 equals $0. What that means is days 1 through 20, you're not going to pay anything. Now, after the 20th day, each plan has a little different way they approach a payment and a co-payment. Sometimes it happens. It's kind of rare, but what I would say is if you're in a skilled nursing facility for that long, you probably want to check with your doctor again and see what they can do to look at you and make things better. But just 1 through 20 is $0. So they're all going to give you basically 3 weeks for free. Okay, how about our primary doctor? You want to go see Dr. Kenny G, Dr. Greer. He's going to send you to a specialist. 0, always 0, 0, 0. You're never going to pay to see your doctor or a specialist on all 5 companies. On all 5. Outpatient services, folks, this is surgery, and yes, this includes cataract surgery. Anything that they provide care to you and you go home that day, you don't spend that, it falls under this benefit. Put 0 for all 5 companies. Wonderful news. 0. You'll never pay anything for that. Now, how about the ambulance rides? And this gets funny. For Aetna, put $225. For Scan, put $200. For United Healthcare, put $200. And by the way, folks, this is all ground and air. So if you got to get lifted, this is the copayment. Now, for Blue Shield, put $100, but then add this caveat, put each way. So don't get too excited and think, well, Blue Shield's only going to charge me $100. No, $100 each way. So it'll be $200 if you get a round trip. So don't fall for that. And Inter Valley is $195. Our emergency room is $90 for Aetna, $90 for Scan, $90 for United, $85 for Blue Shield, and $90 for Inter Valley. Now, here's a caveat to that, folks. If you go to the emergency room and they admit you into the hospital, they waive that $90. It becomes a hospital stay now, which we know is free, $0. But I want to warn you about this tactic. Sometimes you'll go home and you still get that $90 bill and you say, what happened? I spent the night. They fed me breakfast. Well, what happened? You were never admitted. So keep that in mind. What a terrible thing to have to remember when you're in the hospital. But I just start screaming down the hall, am I being admitted? Make sure you're admitted, then that 90 gets waived. Okay. Urgent care. They're all $0 except United. United will charge you $20 to go to the urgent care. All the other ones are $0. Most of the carriers have specific contracts where they can do that. If you're a real big carrier like United, according to Forbes, they're the largest. They just do a blanket copayment throughout the country, $20. Okay, so durable medical equipment. What is DME? Durable medical equipment, stuff we need, canes, oxygen tanks, walkers, anything that's physical equipment that they prescribe to you. Guess what, folks? The plans are not obligated to cover it, so it falls under Medicare. And Medicare, as we know, original Medicare is what? Going back to the 60s? 80-20. So what you're going to put there under DME is 20% for Aetna, 20% for Scan, 20% for United Healthcare, 20% for Blue Shield, but only 10% for Inter Valley. So Inter Valley will give you a little discount on their durable medical equipment. You say 10% of what? Well, I don't know. It depends on the cost of the thing they're giving you. Right? Okay, how about lab visits and x-rays? Always free. This has become like getting water at a restaurant. No charge. There is one kind of x-ray you can get, though, that does charge. What is it? It's the MRI, the CAT scan, the CT scan. You know why? Question? Yeah, because it costs the doctors like $1,000 just to turn the machine on. So the insurance company says, we'll pay for it, but here's your end of it that you'll pay. So for Aetna, put $0. For Scan, put $50. For United Healthcare, put 0-50, meaning it could be free, but if they use a certain machine, it might be $50. Blue Shield, $0. And for Inter Valley, $60. See, because they were nice to you on the cane and the oxygen tank, the 10%. They got to get it back somewhere. See, so okay. Everything we just talked about, folks, is core benefits. Core benefits the plans are offering next year. You now have their star rating. Everything I'm about to talk to you below is now medicine related, prescription drug. Apples and oranges, this is two separate components. What does that mean? It means what you're going to spend on your medicine does not go to that $999 out-of-pocket max. It's two separate components. Okay. So let's talk about this. Part B drugs, before we get into that, what is Part B drugs? Well, you know, they're specific specialty drugs, chemotherapy, certain very specific aggressive cancer and leukemia drugs that I hope none of you have to take. And all we're going to write there is 20% for all of the first 4 companies, but 15% for Inter Valley. So once again, Inter Valley gives a nice little discount there. Now, you see here where it says initial RX coverage limit. And then you see down at the very bottom where it says coverage gap. I'm going to give you those numbers, and then I'm going to fill in the middle and explain it to you. So right now, folks, for initial RX coverage limit, right in there, for all 5 cells, right in there, 4,130. 4,130. Now, I'll give you a second to fill it in, all 5 blocks there. 4130, 4130, 4130, 4130. Now, at the very, very bottom, folks, go down to the very bottom where it says coverage gap. And in all 5 of those cell blocks, I want you to write 6,550, 6,550. And, yeah, 6550, 6550. All 5 companies, 6550. Everything in yes, sir.
What is coverage gap?
I'll get it right in it right now. Everything that's in between that gap that we're going to talk about is considered what they call the gap, or you may have heard its slang term, the donut hole. I don't know if you've ever heard that. It's just really unfortunate. We were hoping it would have been legislated away by now. It was scheduled to leave in 2019, January, but it's now being phased out 5% at a time. This is the very hard thing to explain, but I'm gonna do it anyways. So in order to explain the initial coverage limit and the gap, let me just start out and put it in plain terms. So you start out, all right, you've had Christmas and your New Year's party, it's now January. Every time you go to the pharmacy to get your medicine, and whatever you spend, and combined with what the insurance company spent, they keep a running total. So if the medicine was $100 and you paid $5 copayment, what's the total on your docket? $105. The next month, it'd be $210. And you'd say, well, I only spent $10, but the insurance company is paying the bulk of it. And when that money, as you're going through January, February, March, and I hope this doesn't happen to any of you. It happened to my mom in September. If that dollar amount that you and the insurance company are spending together reaches $4,130, you're now in what's called free fall, no coverage on your medicine. It's called a gap or a donut hole. Just a donut hole free fall. Now that's the way it's designed by law. Now a lot of these insurance companies, especially the ones that have the money to do it, they're going to try and help you in that gap. They want to keep you. So they're going to give you a lot of your medicines the same price, and there's all kinds of things you can do, and I'd be happy to help you to work around that donut hole, but it's just a terrible thing. Now, so then when it hits 4130, what happens? You're spending 100% of the price for the medicine if you don't get that help I just mentioned. Until what? Until it turns into $6,550. And once you hit that, if you hit that within 1 year, now your medicines become considered catastrophic and you're going to get them for $0 or the most $1 or $2 or $3. But that is the high and the low of that, and it's unfortunate. So my mom, right, she takes Xarelto, a blood thinner, and it's a tier 3 drug, $47 on her insurance plan. And she drives through Walgreens and she gets it. And then it went up to about $191 in September. And she panicked. She drove home, she called me. And I says, Mom, you hit the donut hole. And what she was able to do, and not to put pressure on our physicians here, but luckily she approached her primary doctor. And her primary doctor was able to give her some free samples of that Xarelto to get her through the year. Not every doctor has that. It's just a luxury. The pharmaceutical reps drop them off with the doctors for that reason, to help someone that's struggling, that can't get their medicine. So anyways, if you forget any of that, always have an agent. If you don't like me, I'll tell you what, get someone else, because you win, win, win. You only win. You pay us nothing and you get our help to advocate you, get you out of trouble. Going through healthcare is like going through a rainforest, jungle. It's uncertain. There's snakes everywhere. But if you have a tour guide with a machete, I'll go through it with you. I don't know what's on the other side of the mountain, but I know I'm going to clear the way as we go through it. Okay? So I'm sorry, where did I leave off? So let's get into these medicines and how we could actually approach that 4130. The preferred generic tier 1 medicines. Put for Aetna, we're just going to use flat rates. Put $0. Zero. For Scan, put $0. Bless you. For United Healthcare, put $0. Blue Shield 0 and Inter Valley 0. All the tier 1s are 0. So if you're taking that lisinopril or metformin or something that's a tier 1 medicine, you're not going to pay for it. So that's wonderful. Okay, how about tier 2? Let's go back to Aetna. Put $0. Now that's in network, folks. That's if you go to the pharmacy in town here. If you're off the beaten path somewhere, it could be $20. But in network, it's and you're saying, whoa, what's the network? Kathleen gave it to you. It's in your bags. It shows the whole network of their pharmacies and their urgent cares. So just have peace of mind there. Okay, moving forward. What are we on, tier 2? So put 0 there. And now for Scan, put $14. If you have a tier 2 drug on Scan, it'll be $14 next year. And these are 30-day supplies, folks. If you do 90-day supplies or let them mail it to you, if they offer that, you'll get a discount. But I'm giving you the worst of the worst. I'm giving you the 30-day hard price that you would pay at your local pharmacy. For United Healthcare, tier 2, put 0. It's wonderful. 0, 0. It doesn't matter where you're at. 0. Even if you're out of network, 0. Okay, Blue Shield, put $3. Wonderful. Tier 2, $3. And for Inter Valley, $5. How about those? Now, those are your generics, folks. Here's your brand name drugs, which is just terrible that they do this. I hate having to say this to you guys every year because these prices are so overpriced in my mind. But preferred brand name tier 3 drugs, they say it's harder to get. Okay, $37 for Aetna. $37 for Aetna. $37 for Scan. $47 for United. $35 for Blue Shield. And $47 on Inter Valley Health Plan. Anybody in here take insulin? Okay. I won't address it, but maybe for the camera I will. The new laws are coming out. The insulin hard copayment is now $35. That's wonderful news. That's what the companies have to pay. They don't have to. They can charge you less if they want, and some of them do. And there's some excellent options out there for insulins, and I thank God none of you have to take it, but if you need to, or if you know someone that does, give me a call and we'll find a good situation. Tier 4, this is real expensive. Tier 4, put $99 for Aetna. $95 for Scan. $100 for United Healthcare. $95 for Blue Shield. And catch this one, folks. For Inter Valley, put 25%. So it's not a dollar amount there on Inter Valley, it's percent.
Those are all 30 days?
All 30 day, yes, sir. And again, if you work out with them to give you a bulk more, you usually get a discount. Okay, specialty drugs. Now, specialty drugs, again, they're like Part B drugs. They're your more aggressive cancer and leukemia drugs and specialty drugs that I hope none of you ever have to take. But this is a flat Medicare rate. Put in all 5 boxes, put 33%. 33%. Depending on what the specialty drug is. So again, it's carrier specific. One company might have that drug at a certain price and you're going to pay 33% of it. And that's why it always behooves you to price your medicines with a broker. I can't stress that, guys, to you enough. My mom says I'm a good agent. I think she's biased. But the truth is, you need an agent, and I'll tell you why. And if it isn't me, that's fine. Go with someone because you're not going to pay us anything. And yet every year we'll audit for you free your medicines to make sure you're getting the best bang for your buck and the right deal with the right plan. And that's peace of mind. And so I would just encourage you to do that because you want someone who's looking out for you. And again, it's a free advocacy. So if you have questions, about the hospital, the pharmacy, the only thing that's not here on this grid, folks, and every one of you has my card, or you can get Renee's card. You can call me, and I'll be happy. Now, 2020 is a little different. It's weird. Normally, I just go to your house, fire up the coffee pot, right? Can't do that now. It's different. It's a different world, and I really hope things will go back to normal in a few months, and I think they will. But right now, if you want to meet with me, call me. And if I can't help you over the phone, I'll Zoom with you over the phone or the computer, or we can work something out. Some clients, I've gone and sat on their front porch with the mask on. Some clients, they knew what plan they wanted, so I was able to leave the materials with them. They signed it, put it in their mailbox. I picked it up later that day. There's all kinds of things we can do to accommodate you and keep you safe, okay? But again, get an agent. If you forget everything that I've shown you today, just remember, it advocates me to have an agent. Why? Because it's free and they're a tour guide with a machete. Okay, but again, my name is Jason. I'd love to be your agent. My mom says I'm a good agent. My daughter thinks I'm just great. I think they're biased, but I really do want to be who they think I am for you. And so I don't have anything else for you. If you have any questions and you don't want to go on the camera, you can ask me afterwards or whatever. Do we have one down here?
I do. I get a prescription from CVS.
Mm-hmm.
90 days
Excellent.
and it's $14.
Excellent. So he gets a 90-day prescription through CVS, through his insurance company, and it's just like I said, they discount it for him. Wonderful.
But you have $14 here.
Well, remember, sir, these are next year's benefits. That's not the current situation you're under now. So these will be next year's. You're talking about the 14 on for scan? Yeah, tier 2 will be $14. No, I'd have to get my scan booklet and help you with that after, but I think that is the same benefit. Let me double check that for you. Well, for the 90-day, if they're offering a discount. I know that scan historically does. So that's probably good news for you. I think you're going to continue to enjoy that benefit. But I'll confirm that for you. Any other questions? Yes? Okay. I didn't talk about them. I'm so sorry. Call me this afternoon. I'll give you all the details on them. Well, they got a number of plans, and I want to see which plan you're talking about. That's the gold? Yeah, well, I got all of their benefits written down in my office, and if that be the case, I'm sorry to hear that.
Well, we got two different. One says 0, one says 40.
Okay, then it's two different plans. They can't both.
No, it's not.
Is it the same year? Okay, well, let me look at that, and let me get into that for you here afterwards. That's curious to me. I want to see what they're doing. Because if it's $40, that's not a good deal, is it? Yes?
I know initially when I started with Medicare, it was $104.
Yeah.
And everybody,
It goes up, and it's terrible. Yeah.
so are any of these plans that you don't pay that $145?
No, you're going to pay. You have to have, good question, in order to qualify for any of the Medicare Advantage plans, the HMOs that any of these insurance companies have, you have to have Medicare A and B. Okay, so don't be like my dad that's got VA and passed Part B. Now he can't get any of these plans. He just has VA. So you're doing great then. And you have VA and you have scan, so you have Part C. So you have everything. You're 100% covered. If you have a Part C plan right now, an HMO plan, you're 100% covered, folks. You can't get any more than that. Now, if you want to check your medicines to make sure, like this lady says, just to make sure nothing funny's happened, that's what we should look at.
How does SCAN know that I have VA?
How does scan know that you have VA?
So that I won't get deducted $145?
Oh, you still get deducted for Medicare, whether you have VA or not. Yeah, Great question. The good thing about having VA, sir, you're like my uncle, and privatized insurance through SCAN, is you can have both at the same time. And it gives you the ability to have a second opinion. Or if one medicine's cheaper on another, you can go with that one. But unfortunately, we can't get out of that Medicare premium by having VA. I wish we could. Excellent question. Any others? Yes? Yes, I believe she's asking about the over-the-counter benefits. It's a catalog they'll send you where you can order free stuff and they give you an allowance of money. If I'm not mistaken, these plans are brand new, they just came out, but if I'm not mistaken, every one of them's offering it. Yeah. What's that? Oh, I know the amounts. I have them all written down. I don't have them here to give to you today, but I know that a lot of them have gone up. What I would tell you folks, though, and this is just my experience, is pick a company based on stability. What does that mean? If you're going to get an airplane and fly to New York, would you want to be in a jet that's going to rattle you around and scare you to death? Or do you want to be on a very stable Boeing jet, a huge one in the sky, where they play a movie for you and bring you dinner? Okay? So what I'm saying is a lot of times in the market, we'll see smaller jet companies, and I'm not identifying any of these as them. I'm just saying they fluctuate their benefits. And they'll give you an apple here, but tomorrow it's a lump of coal. And they change those things. So what I say is don't, and this is just this is nothing, this is just personal advice, but don't base your decision on those little carrots they offer you. Well, I get $20 more spending cash on there. Well, hey, that could change quick. In other words, go with a company that's been good and loyal to you and that you work good with, and you have an agent that can advocate for you, and you got peace of mind. You're 100% covered. And you're going to get the over-the-counter stuff. And any other need you have, let your agent know. And we'll find the right plan for you. That's an excellent question. Anybody else? I don't want to rush you guys out of here. You got good questions. What's that? The DME, yes.
I know originally I was getting an oxygen generator and there was no charge. But I think that the company that now provides those has raised their prices. So if it's over $100, they're now charging the $20.
Yeah, it could be that your insurance company changed vendors. So the question for people watching in is, you know, that you were getting the oxygen tanks and it wasn't costing you nothing, and now there is a little co-insurance. And that can happen to you if they change vendors. And at that point, I usually like to call the insurance company and say, has there been a change in the vendors? And that's another thing to help you, might weigh in on your decision to switch plans during this enrollment period. All that little stuff. If there's any stones in your shoe, little gouging cost here and there, call us. Let us look at it. If we can't fix it, I'll tell you. I'll say, it is what it is. But if we can, you'll be happier you did. It won't cost you nothing. And there's no harm in asking. But other than that, I want to thank both our physicians, primary care physicians. I'm so glad to see Choice growing. Last year we got Dr. K, and we just keep adding young, good physicians, and this is a good sign for the high desert. Other than that, you all have my card. If you're like me, you get in your car and you drive 10 minutes away and you go, oh, I forgot to ask the guy this. If that happens, just call me. If I don't answer, it's because I'm talking to someone, but I swear I'm going to call you right back. Okay? Thank you so much for coming. And make sure we get our... If you need a pie voucher or anything, I know you guys don't come for the pies, but if you do, make sure you get that squared away with Kathleen up there. How are you doing, sir? Good questions.
I have another question.
Yeah.
My daughter, she's 35, she's disabled, she has Medicare. But she's still getting an insurance cost of hundreds of